folks. Thanks for joining us today. My name is John Dubas with Premier Marketing, and we'll be spending the next 45 minutes or so discussing how we can sell and cross-sell electronically and compliantly, with our featured guest being Anna Patrick with CSG to go through some of that with a key component of our systems that we've recently rolled out. You'll recognize this system as one that we've had in play for you for a number of years, but with some of the access changing and CSG doing a remarkable job of adding additional components to their system that we can share with our agents at no cost, let me add. It's very helpful to have her guiding us along the yellow brick road, so to speak. You'll notice in the software that there is a section for questions. We ask that you add those as they occur to you. Keep in mind that in most cases we will answer most of the questions by the end of the presentation, but we will double check after Anna completes her portion of the presentation and at the end of the presentation to make certain that we answer all of your questions. Today's presentation is being recorded. We thank you for coming on live and spending time with us, but it is being recorded, and it, along with information that we reference through the course of the presentation, will be sent to all who have RSVP'd for today's webinar. We'll start with a bit of level set that may be repetitious for some, but give you a little information about who's Premier Marketing. We're a national marketing organization founded in 1968. We're part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler and providing insurance services to the public through independent insurance agents such as yourself, and we do so through contracts that are at the highest possible commission levels, with recruiting contracts available to those who qualify. As I mentioned, being founded in 1968, that means we recently achieved a milestone in our own history, our 50th anniversary, which we consider to be a great accomplishment for what started as a small family agency in rural Nebraska that's grown into one of the largest marketing organizations in the insurance world, actually. We do so through a full insurance portfolio that includes the programs for folks on Medicare, the Medicare Advantage and Medicare Supplement health programs, and the standalone Part D prescription drug plans. But we also offer a full portfolio of life insurance and annuities, including final expense life insurance and pre-need plans. We also offer long and short-term care programs, disability income plans, and ancillary benefits such as dental, vision, and hearing programs, critical illness and cancer plans, and hospital indemnity programs. We do have a webinar tomorrow on hospital indemnity and on Thursday on critical illness and cancer. So watch for those if you would. In the Medicare Advantage world, we contract with all the national carriers and many of the strong regional carriers that can make a difference for you in your market. And that same philosophy carries over into the standalone PDP realm, where those standalone prescription drug plans are available to you from all the national carriers as part of the contracts that we offer. You will notice that this slide still includes Envision RX, even though Envision RX has pulled their product from broker distribution. There are some things going on there to make certain that you can control your book of business with that organization, still get paid for certain things, and realize that 2021 is a whole new offering with PDP programs. There's a bunch of folks out there really aggressive. We just wanted to remind you of that fact. When you look at Medicare supplements, we have a very robust portfolio there as well, and it includes different tools that can make you successful in that space, including the use of our featured speakers programs today with CSG. When you're looking at the ancillary products in each of those categories, we have the national players in those areas available to you. We're also adding a name carrier's accidental policy as well. Watch for information on that being rolled out. But you'll see that these programs address some of the needs that aren't covered by the medical programs for people on Medicare, and these have a greater range of age. So a lot available in many circumstances to 18 starting age, or some of them at 0. So it's a great way to create another revenue stream for your agency, but also another marketing tool that not only offers a program that is a demand product, but fills the needs of the folks that you're visiting with. And the cross-selling component comes into play with that, and that's part of what we'll discuss with the tools today. When we look at the Medicare market overall, you don't come on a presentation like this without someone speaking of the silver tsunami, the aging of the baby boomers, 10,000 people a day, one every 10 seconds. Well, if you look at the Medicare market in just terms of age, you're a little off, to be honest, because yes, that baby boomer generation is really rolling into Medicare, but you're also seeing a trend where some folks think they're not accessing all their Medicare benefits right at the age of 65. Many continue to work, and you'll see that that pares that number down a little bit, but when we realize that about a sixth of the Medicare population is actually comprised of the folks that are accessing Medicare through medical disability, we have right around 59 to 62 million people on Medicare. 3 million people is kind of a large gap there, John. I've seen different numbers come out from different organizations, so I hedge my bet. But it's a good, healthy market, we can tell you that, and it's a diverse market. By healthy, I mean there's a lot of numbers, and a lot of those numbers are actually affected by things going on with their body. 2/3 of the population has 3+ chronic conditions. Half of them have 5. So you see folks that are struggling with some health challenges that bring out the need for us to account for the challenges they have with their budget as well. Their income and savings are, median income from the last numbers that I've seen now that are updated from this chart is $26,200. So if you look at some of the things they need as support for their lives, planning with insurance programs to handle the different things that can happen to us in our body are very important for us. And that's where we need a strong portfolio of carriers, a strong portfolio of products, but we also need that electronic support that enables us to reach as many of these people as possible and do so efficiently, because they're going to have choices and we can help them with those choices. If an individual decides to do nothing, and an old sales manager of mine at Prudential longer ago than I care to admit said, a decision to make a decision is a decision. And that's true. They don't even have to take the optional B if they don't want to. The vast majority of people do because it's just a smart thing to do. But they may choose after that to self-insure for everything else. Or they may pick up a standalone Part D program to cover their medications, or look at some of the medical costs through either the standardized, modernized Medicare supplement programs or choosing a Medicare Advantage plan that incorporates the A, B, and D all together. In any choice that they make, we have options for them, and having the tools to deliver those options as painlessly as possible, as efficiently as possible, and as accurately and compliantly as possible makes us all winners when we deal with the population. And what we're seeing is as people age in to Medicare, they're making a near even split for their medical purposes when you look at the Medicare Advantage and Med Supp enrollments for folks that are first accessing their Medicare benefits. Keep in mind that's the age-ins. Those are the folks that come in later as well. What they're referred to on this DEF research chart as late to Medicare seniors. So you see some folks that have a need for discussion with an independent agent, and then we'll see the folks that have original Medicare as on this. Well, that could be retirement benefits, that could be dual beneficiaries, that could be people accessing benefits through the VA or self-insuring. So in each of the categories, once again, we need to help them because it's diverse in the background that they have, and making certain that we do the proper fact finder and do what we need to do to enroll them in the proper program makes all the difference in the world. Since we are in the Medicare arena, sometimes a little guide as to what some of these acronyms mean can be helpful. This is going to come to you as in the follow-up, a link to an acronym guide for the Medicare world from CMS that I think that could be helpful for you. So when we look at some of the systems that are out there and what we need to do on helping people with the evaluation and enrollment process, we have to watch a number of different things that are not just a resource, but a tool for us to use. And for the Medicare beneficiary, there's still a portion of them that don't have internet-enabled devices. Some of them don't have email, texting, or internet. Some of them have technical proficiency if they do have the tools. Some have challenges with their health that make it challenging for them to use a smartphone versus a computer because of challenges with hearing or eyesight. There are some folks that we run across when we're doing face-to-face appointments that are clues as to possible dementia, and we know that if that is the circumstance, we want to make certain that we investigate for possible powers of attorney or whatever we need to make certain that a responsible person is signing an application. We are a culturally diverse society, so there may be challenges with folks speaking the same language or speaking at all. My mother had a series of small strokes before she passed. Her brain knew what she wanted to say, her mouth didn't. So there are things that we have to do to make certain that we, as a slide I borrowed from CSG's post on LinkedIn yesterday, we got to do what is right, not what is easy. So we can use the plan finder at Medicare.gov with some of the challenges that we saw in that last year that they're looking to address and create a bit of information for ourselves and for our clients as to different programs that are available. But this was never intended to be a sales tool. It's an information tool for the public, even though until some things changed last year, a whole bunch of us used it that way. Well, they've done some improvements on it. We've got some information on you there for you to look at should you choose to access that information. I do all the time to find out what plans are in a particular area. We may change that with some of the improvements that we've done on Medicare Center, but this is available for you, and it's even available in Spanish. It's one of the things that I haven't seen in some of the different tools with multilingual type of capability. You have a couple of other national organizations that are creating resources as well. The National Council on Aging is rolling out a tool based on their work with the My Medicare's Matter, and so you see some different information being made available there. But the challenges we have with any of this is we don't have full control of the prospect or client. We don't have a database system we can really access to market and cross-sell year over year or throughout the year. The information that was in Plan Finder before 2019 is gone. So having a repository of that information is very important. We also have to have a means to compliantly provide the information that a client needs. And we want to make certain that whoever works for that sale gets that sale. So that's why we looked into a number of different programs that are out there. There are an increasing number of companies that are reaching out and visiting with us about different Medicare Advantage and PDP programs, sales systems remotely, that sort of thing. We've had a contract with CSG Actuarial for a number of years, and so that's not a challenge when you look at some of the programs that we'll run through in just a little bit. But the Medicare Center program we had was powered by Connecture. That is, incidentally, the company that powered Medicare.gov's Plan Finder until that contract changed in 2019. There's a program out there called My Medicare Bot. That is actually the second project by the founder of Connecture. There's the Sunfire program that is very popular with a lot of people, and a Trusty Select Pro that does much of the same thing. What the Integrity platform and Premier specifically has done is created a single sign-on from multiple tools for an agent to use, but that means we need to know about these multiple tools as well, even though it's a single sign-on to get in to access them. And so that's why we have asked CSG to give us a little bit of assistance in going through the use of those programs as well. So once we roll through Medicare Center, we're looking at that all-in-one universal login to get into all three programs. It does come with a simplified CRM that can be utilized without cost by an agent. One of the things that we've discovered in discussions with our agents is many of them don't have a CRM that they can use. It's a nice program now. Improvements are coming down the road as well. So it's a very useful tool to help in an overall marketing situation, and it can help with all three platforms. So we look at what we need to do to use CSG's tool as efficiently as possible, take advantage of the different components that are in it, including the electronic scope of appointments and the eApps. And that's what we're going to spend a whole bunch of the time today, if I ever shut up and let others speak, on the eApp process, because let's face it, we're in a pandemic situation that's unlike any time in any of our lives, or working lives at least. And I can say that because I think the last really one that everybody refers to the Spanish flu in 1918, something like that. But regardless of what happens with COVID-19 moving forward, we have an increasing emphasis on the use of electronic tools, and that'll never go away. It's only going to increase the need, and so we want to make certain that we roll into the tool. And we ask our guest speaker, Ms. Anna Patrick, to give us a demonstration as to how this program works in that. And I am going to turn the program control over to Anna. Thank her for coming on and helping us, and shut up and let her go.
All right. Thank you so much, John. And thanks, everyone, for taking time out of your day to be with us. I'm really excited to show you some new features on the CSG quoting tool that you have access through Premier. And just as we got on the call today, I added a new shopping cart feature on here. So I'm really excited to be able to go over that with you. Again, we know during this time we are going to be doing more business electronically. So I want to provide you with the resources that you need to do that. Most of you should all be familiar with our quoting platform. You're able to run quotes for Medicare Supplement, Medicare Advantage, PDP, final expense, hospital indemnity, and senior dental and vision. So I'm not going to spend too much time on the quoting tool itself. We can always come back to that towards the end. But I'm going to mainly focus on the enrollment piece with the Medicare Supplement, and then the new shopping cart feature. And then we'll also get into the electronic scope of appointment and document locker. So when you run a quote for the Medicare Supplement, normally you'll enter in the zip code, the age, the gender, and the tobacco status, the effective date, apply a household discount or not. You're now going to have this option to do a client/applicant. So this is where you can enter in a client's name or select a previous client. What this will do is it will store all of their quote information. So it will store their zip code, their age, their gender, and their tobacco status. And then from there, you can always adjust the plan type and the effective date. That way you don't have to enter in that zip code every single time. You can still run a normal quote by just, not putting in anyone's information here, but you can certainly run a quote that way as well. From there, you'll just hit Get Quote. And then on the quote results page, we will show you a complete list of plans that are available for you to write. Of course, we always list them out by your sort, so probably by that monthly premium. So you can see a complete list of different companies here. Now, any companies that we have on our e-application platform, you're going to see two buttons. You're going to see an Apply Now button, which takes you right into the application. You're also going to see this new Add to Cart button. So what this allows you to do for any carriers and products that we have on the eApp platform, you can add products to an individual's cart. From there, you can see that cart icon right here at the top, and then it will save that client. So we can add different products into this client shopping cart and do one checkout process for the applications. It will ask you to verify that you are appointed with that carrier. So all you have to do is enter in that carrier's appointment, and your appointment, either your writing number or your agent number there to get into the application. or you can go straight into the app itself by hitting apply now. So there are some products and carriers that we have available on this cart feature. So let's say we ran a quote for Bob Smith, we added in his med sup plan, and then we wanted to go ahead and add a dental and vision plan. So this is going to help you cross-sell more. Once you hit that dental, it's going to automatically carry over all of Bob's information here, carries over his zip code, his age, his gender, tobacco status, and then you can hit get quote. And then you can add in any of the dental companies that we have on the eApp platform. Now we are continuing to add companies to this, so we don't have every single company added to the eApp, but we are striving to get there for multiple carriers and multiple products. So if I wanted to add a dental to his cart, I now see in the upper right hand corner I have two items in the cart. I have a med sup and I have a dental. And then you'll notice here it automatically updates that gross premium cost. So now I can provide him, if we got you a med sup and a dental, this is what the cost is going to be. And then from there you can just hit checkout and it will start taking you right through the applications. So I'm going to just pull up another screen here. If I wasn't doing a cart and I just wanted to do a normal eApp, when I would hit the apply now button, the first thing it's going to ask me is to validate that I am appointed with that company. The first time I enter that, it will automatically save it for you. So you don't have to enter it in every single time you hit apply now. It will automatically remember you and take you right into the application. So I'm just going to pull up a testing environment here so I can walk you through the eApp start to finish and not have any issues on that. So once I hit that apply now, it takes me right into my med sup plan. So let's say this is the quote that I originally ran. So when we think about a universal application, what we're trying to do here is have one process or one eApp for you, the agent, to learn. We understand that every single company has a different platform, and it can be difficult remembering how to use every single platform. So when you submit an application through the quoting tool, it will be the same process for every single carrier. So I'm going to walk through a Mutual of Omaha app here, but it's going to be the same process, the same look and feel if you were doing an Aetna or a Guaranteed Trust Life or an Americo application. It's going to be the same process. So it will automatically carry over that quote information, and then it will carry over my writing number, my producer number. From there, we'll select the underwriting type. If you're not sure which your underwriting type is, we do have that information there for you to click on to help you better select that plan. What this eApp will do is in real time, it will underwrite for you. So if you try to submit a guarantee issue or a full underwritten policy, but it's really an open enrollment situation based upon your plan eligibility and the information that you enter in, it will tell you this is not a guarantee issue situation. You need to change your underwriting type to open enrollment. The same when we go through the plan eligibility. So if I initially quoted a plan F and based upon my individual's Part A and Part B effective dates, if they're not eligible, the system will notify me of that. So that is what we're going to do here. I'm going to go through and submit this application. So we'll start by entering the plan eligibility. We'll go ahead and hit continue. Now over here, after I enter in my plan eligibility, it's automatically going to populate the sections that I have to go through and complete. Now the sections will be the same. The only difference in the sections would be if it is a state-specific section or the questions are going to just pertain to the company itself. So the health questions that you answer and all of the required pieces that are normally through that carrier's application will be required on this. You can also obtain any initial documents. So if you needed a copy of the outline of coverage, the guide, the application, if you wanted to email that over to somebody, you can also do that through this initial documents. So as I get into the application, you'll notice here on the sections, I can go through the sections. Once I have completed a section, it will have a green check mark. If there's still a section I have to go through and complete, there will be this yellow air icon, just letting me know that that section is incomplete or needs more information. You can go through these sections in any order, or you can just go through the app in order, hitting continue on each section. You'll notice here on the right hand side that I can't even select a plan F because I'm not eligible. So I can switch my plan type. If you go through the whole application and then your client says last minute, oh, I want to go to an N. No worries, you can just go back and change the plan type to an N. It will automatically update the premium over here on the right hand side. So I'm going to go through this application just to show you how easy it is. I believe I did a male here. Nope, I did do a female. Sorry about that. We'll do first name, last name, the address. And now what's good about if we were using the cart feature of this tool, as soon as I submit my Medicare supplement application, all of this address, the phone number, the email, all that's going to carry over into my next dental application. So it really streamlines that process here for you. So email address, date of birth, if I would change my age or my gender, or if I was outside of the height and weight requirements, it would tell me all of that and update the premium accordingly. Select no for these and then hit continue. Yeah, you'll also probably notice there's no save button on here, and that's because as I go through and complete each of the sections, it's automatically going to save for me. I can always get out and come back in, and all of my data that I've entered will be stored. Household discount, it will give you that definition. I originally quoted non-household discount, but if I would change this to yes, it would automatically update that premium for me over there on the right as soon as I hit continue to the next section. Medicare information automatically carries over that Part A and Part B effective date. Yes and yes. And then we'll get into the previous existing coverage. Now, just for time's sake, I'm not going to go through a fully underwritten plan. However, if I was, this tool would populate the health sections and the medication sections, so I'd answer those accordingly. And as I answer those questions, it is going to underwrite for me in real time. So if I enter in a declinable drug, the system will notify me. Some carriers may stop you right there and not even allow you to submit the application. Other carriers like Mutual will just notify you that you've answered yes to a decline health question, but they're still going to submit it, but letting you know it could possibly be a decline. Now, when we get to the method of payment, the first option that you may see is a wet signature option. So this is if you wanted to fill everything out via a PDF and then print it and have the applicant sign it. Since we are doing it electronically, we are going to select no here. And then the automatic bank withdrawal, we can select either a checkings or a savings. And then this feature is really cool in the bank. You can just start typing in the bank name or type in the numbers of the routing number and it will populate your bank options here for you. Account number. Automatic bank withdrawal, particular day, you can select that. All of the payment information or the payment options will vary based upon carrier on what they allow and what they don't allow. And then the to be completed by producer section where you're going to deliver it. You've accurately recorded everything. If you had to provide any notes to the underwriting department or upload any supporting documents, this is where you would do so. And then you'll just hit verify application. So you can see this application process was really simple, really quick and easy, just going through each of the sections. You know the section is good once it has a green check mark. This last section allows you to look over all of the sections to make sure everything is submitted in good working order. Pay close attention to this email address right here. So we are going to be I'm going to show you the electronic signature via email. I know a lot of you will be using that feature here during AEP, so I want to show you that. So if you entered in a wrong email address, this is where you can go and edit that email address. Everything looks good here. I'm going to go ahead and lock an e-sign. This is just them agreeing to the terms and the conditions of the electronic signature process. So we'll select I agree and then continue. And then for the signature, so a couple of important pieces to look at here. If you are in the same physical location as the client can provide identification information. From there, they will have to open up each of these forms until they turn green. So you'll have to open up each of these. Once you have opened up all of them, you will check mark I have read and kept a copy of the above documents, mother's maiden name, last 4 digits of their social security number, and then acknowledging the state that they're signing in. They'll hit apply e-signature, and then it carries over your producer name and your producer number, and then you'll hit apply e-signature and then sign application. So once you've completed this portion of the signature, once you've hit sign, it will then take you to the page and let you know that that application has been submitted, and it will give you that policy number. Now, what I want to show you today is the email signature link. We are working on a text signature link that we should have available next month. So it would allow you to send a text to somebody's phone and allow them to just open up that link on their phone instead of an email address. So you'll see that email address carried over from the application. So if for some reason this is wrong or they want to send it to a different email address, you can go in and edit that application there. So it automatically carries over your producer name and your producer number. You'll select apply e-signature and then sign application. So once this has been signed, it will just tell you that the application is now pending the applicant's signature, and then it gives you an opportunity to view all of the documents here. If I click on application, it will pull up a copy of that application here that's completed on that carrier's paper. So everything is still on that carrier's paper, and then all the data does get submitted to the carrier in real time. So I can go ahead and I can tell my client to check their email. You, the agent, is also going to be CC'd on an email letting you know that the application was sent over to them. So this is what it will look like when your client gets the email. It will have your name on it, and it will have the insurance company's name. So it will say that you, the insurance agent, is asking for your signature. What they will do is they will copy this code, or they can write it down. They'll click on Verify Signature with Code. They'll enter in that code and then their date of birth. I believe, did I do 9/1? And then I'll hit Verify. And then they will just agree to the terms and the conditions of the electronic signature by selecting I agree. And then that individual has an opportunity to open up each of these documents. So they can review the application, they can get the guide. That way you don't have to send them all of the paperwork. They automatically get access to it here. So that's convenient for you. They'll check mark I have read and kept a copy of the above documents. All of these do have to be opened up in green. So if they say I can't check mark it, it's because they didn't open up each of the documents. So then they'll just acknowledge the city, the state that they're signing in. And then they'll enter in their zip code and then apply e-signature and then sign application. So really, really simple steps for that individual to go through. Again, we're going to be launching this via text as well. So this process will work the same way, where it will send them a link and a verification code via text message, and then they'll just open up that link on their phone, and then they will have to open up each of the documents and sign. So those steps are going to be the same. It's just a different option if they didn't want to use their email. So once this has been prepared, it will then provide them with a policy number and when it has been submitted. Now, I'm in a testing environment, so it's not going to provide me a policy number, but it would provide you with one once you're done. So then once this has been completed, you, the agent, can go back and view your applications here at the top, and then it's going to say that Susan Smith, her app was submitted. If you were actually submitting the policy, it would give you that policy number here. So this United National Life Insurance Company, you see that policy number is right there. That's how it would look for all these other ones. And then you can view those PDFs. If you wanted to check the status of that application, you can always go to the agent portal on that carrier's website to check to see when it has been issued. So we won't let you know on this system when it's been issued. You would have to check on the carriers, but we will tell you that it's been submitted. You'll notice I do have some incomplete, so these are applications that I've started and I just have not completed them. So this is where you can always go back in and edit that application. Any incomplete will store for 90 days. Completed will store for 60. So if you do need to download that copy of that application, you can always do so on there. So that is the eApp. I highly encourage you to go into the eApp and at least test it out. You can do exactly what I did today, except once you get to the signature portion, just stop and then make sure that once you're done with it, you can go back in and delete it. I know you as agents, you want to get familiar with the tool before you actually have to use it in front of a client. So feel free to test that out and just get familiar with how it works. We always encourage that as well. One last thing I want to go over here before we start taking some questions is the electronic scope of appointment. So we know that, again, a lot of you guys will be doing business electronically this AEP, and a lot of times you're just not sure which carrier that individual is going to go with. So you do want to get a generic scope signed and documented so you can start that conversation and start reviewing their options with them. So within your Premier tool, you see two buttons here. You have your eSOA doc signing and then your document locker. The document locker will store all of your completed scopes that you do on this platform. Those scopes will is stored CMS compliant, so for that 10-year period for you. So what you'll just do is to start an electronic scope, you'll just click on this view list. And then it will take you into it so you can start a new scope. Any ones that are incomplete or awaiting signatures will always store there for you. You can trash those at any time. But this is the scope that we're going to go ahead and start the documents. If you ever wanted to download a copy of a generic scope or preview it, you can do so with these buttons here. But we're going to do a scope electronically by hitting Start Document. We're just going to give it a name here and then save and continue. This is agreeing to the terms and the conditions of the electronic signature. We'll hit I agree. And then you get asked two questions. One, if you're in the same physical location, or you can do the applicant signature link where it sends them a link and they complete it, or the applicant provides identification information, which would be their mother's maiden name and the last 4 digits of their social security number. I'm going to show you that email signature link. I think it's very important that you understand all of the steps by doing anything electronically. So I'm going to go ahead and say we're not in the same physical location. I'm going to do the email signature link. There's the email, and I'm going to hit continue here. So then what this does is it sends the individual another email. So I'm going to go ahead and open up my email again. This is what that looks like. So kind of similar to the scope of appointment, or the eApp. The scope of appointment is going to give them a verification code and a link. I'm going to copy that and I'm going to click on this link. I'm going to enter my verification code and then hit verify and continue. Agreeing to the terms and the conditions of the electronic signature. So this is where your applicant will go ahead, or your client can go ahead and select the products that they want to discuss with you. So let's say they do want to do Part D and Medicare Advantage plans. They'll enter in their name. Then they'll just acknowledge the city, the state that they're signing in. And all of these screens, if you were doing it face-to-face, will look the exact same. So apply e-signature and then sign and complete. So that's all they have to do. Super, super easy. Then you, the agent, will be notified that they have signed it. So you will receive an email letting you know that. And then all you have to do is go back to your quoting tool here. And if you just click back to documents, you can see that Bob Smith, it's signed. So it's already signed here, just waiting producer data. So once you get that notification that it's been signed, go ahead and go in here. We can just hit continue. And then they will just type in their your agent name. So this is the agent confirmation form. So if you want to review to see which products they said they wanted to discuss with you, just click on this preview button down here at the bottom. And then I can see that these are the plans that Bob has confirmed that we can discuss. So that's great. We'll go ahead, we'll have our meeting, everything goes well. So I am just going to go ahead and complete this next portion of the form. Phone number, beneficiary's address, and then plans that we discussed. We did Aetna, Silver Script, state completed, continue. And then it carries over your producer name. So you'll just hit apply e-signature and then sign. Then you will have your completed scope. So we can preview that document here. I can see it's been filled out, everything electronically. And then all you have to do is click Save to Library. So then this will automatically save to your document locker. So this is what your document locker looks like. This is where you can have folders for each of your clients, or you can have just completed scopes that you've done. I've done a lot of them, you can see here. But you can feel free to upload any other documents. So let's say you have completed a ton of scopes. They're all kind of saved in different locations and you want one secure location. Feel free to upload any of your completed scopes previously. Let's say you did a quote comparison for somebody or an application and you wanted to kind of use this as a folder, and you can save all of Jane Smith's information in here. You can absolutely upload any documents. You can create folders. You can create subfolders. So if you wanted a folder for, each year or each client, you can do whatever you would like with your document locker and storing those completed scopes. Keep in mind, you can download, you can preview these at any time. You can always export your entire document locker as well. So if for some reason you're getting out of the business, you want a copy of everything, just go ahead and come in here and you can export all of those, and it just downloads for you as a zip file. I know I went through this super, super fast. I wanted to make sure I left enough time for questions here at the end. So I think we still have about 15 minutes left for some questions. So John, if you want to go ahead and take a look at those questions. Hopefully everyone got a good quick training on the eApp and the eSOA. I know I quickly ran through that new cart feature with you pretty quickly. Your representatives at Premier, they do have a copy of the cart tutorials and eApp tutorials. So if you need any more additional information on that, they can supply you with some great resources.
You bet. Thank you, Anna, by the way. We've got a number of questions, I think, that are kind of evenly split between the two of us. Some of them is Premier procedure, the other is the tool actual in its totality. But the first one asks if, due to all the MA companies' new tools being added in their own portals, will we be able to do the health assessment from all of the companies? I think that question would apply more to the other two programs that are part of Medicare Center. And Angelia, in order to hedge my bet here, some companies will allow it, most will not. They'll require the use of their own tool in order for you to complete that health risk assessment and get paid on it. That includes the Ascend program that a number of the carriers are using, such as Aetna, Allwell, Centene, the Lean program with United Healthcare. They require the use of that in most circumstances for that health risk assessment. The second question is access to this tool, and that is actually CSG does offer this for anyone to purchase. You can purchase the tool directly from CSG as well. In order to access the subsidized version through Premier Marketing, you need to sign into the agent portal on the Premier site and access it through that way. And that way it recognizes who you are and how to make use of the tool without coming out of pocket for it. So, Raynola, I hope that answers that question. The next one is, will there be a way to compare both plans, the N and the G, at the same time to send a quote to the client? What we went through today is pretty much the eApp and the scope of appointment piece, but there is a comparison tool. Anna, would you like to elaborate on that? Did I lose you?
Yep, I'm right here. So I'm going to run a quick quote on the tool. All you have to do is you have to run that first quote. So let's say I initially quoted an F. I can select the company that I want to go with. So let's say you want to quote an Aetna Plan F and an Aetna Plan G, or a female and a male. So once you have selected the plan, it turns it green. It puts that quote in the upper left-hand corner of your screen here, and then you can easily change this over to a G and then run a quote on G. And then all you would have to do is select that company that you want to find here. Here's Aetna. Now I have the Plan F and the Plan G side by side. I can click on the compare quotes, and I have both of those premiums side by side. I can save this as a PDF, or I can print it off, and then you can go ahead and email this over to a client. You can compare up to 5 plans at one time. So you have a nice little comparison here that you can send over. It will have all your contact information. You can upload a photo or your agency logo or anything like that in this comparison as well. So hopefully that answers that question pretty quickly.
Yep, thank you. The next question is, will the signature options include a signature pad in the future?
Depending on the technology for it and what we have available, I know there's a couple of carriers that do allow the dragging of the finger for the signature. So we are looking into that and how ways to implement it. Currently, we're trying to make sure that any type of signature that the carrier allows, that we can allow it on our platform as well.
Awesome, thank you. Reggie, the second question of, when running a quote, will all your companies be listed or only the ones the agent is appointed with through you? That's a Premier, I think, more question than for Anna. It does include all the companies with whom we contract, so you're able to access that information. I think, as Anna demonstrated during her run-through, if you were to try to use the eApp and it was contracted elsewhere, I'm not certain if it would work or not, but I don't know, Anna, if they put in their number, I would assume it would.
Yes, as long as you
contracted.
Yep, as long as you have an active license with that company and you're appointed with that company, you can get into their eApp.
Awesome. Okay. Hopefully, Reggie, that answers that question. Raynola, the other question of 2021 plans be available by 10/15. I will guarantee you that there isn't an insurance company in the world that doesn't want their Medicare plans available by the beginning of the actual marketing period. instead of the sales period, and that starts on the 1st of October. So in the MA and PDP world, you'll see both 20 and 21 plans be made available in the other two systems. I'm going to list them really quickly and include a link to the webinar for that portion of Medicare Center, along with some other things that Anna has pre-recorded as well. They will be in the systems by the 1st of October, though. I can tell you that. Generally, a third-party vendor in these circumstances, they want to make certain that it goes out and then all the proper updates go out as well. But you do find with the PDP program, sometimes through the course of a benefit year, there may be formulary changes throughout the course of the year for one reason or another, and we want to make certain that that is available for you. So I think that's what we've got on the questions. Anna, I'm going to steal control back from you.
Perfect.
And kind of just a few parting words, so to speak, and we'll be look to be done by the 1st of the hour. And here we go. One of the things I wanted to do is make certain that we just kind of review so you see some of these and can reference them. So the eApp platform is very comprehensive with CSG. We're proud to be able to offer that in partnership with the organization. It is available as a mobile tool on your phone. Old people eyes like mine have some challenges with that, but it's great for everyone else. A great way to cross-sell MA products as well. We have a link to a video that will come out on how to do that. And that's basically identifying an MA plan and then filling in the gaps. So the emphasis we want to put not only on obtaining the scopes, but the proper storage of them. Keep in mind that the regulations tell us that we're supposed to keep those scopes if we sell or not. So you want to make certain that you're making use of the platform that allows you to store them here compliantly, securely. And as a hint that I would use on these is, since it is a generic scope and it does list some ancillary programs and the med subs, I would advise the client to mark them all so you can do a full evaluation for them. I would send out one type or another on more of a quick enroll type of situation where they know that's what they have, that's what they want, and they aren't looking to examine the other possibilities. But that does a couple of things for you. It opens up a broader discussion and a way to cross-sell the dental and hospital indemnity programs as well. Just a review that the program also offers the low-income subsidy filter. That shopping cart, I think, is a great piece for you to use in cross-selling, particularly if you're heavily in the marketing, the med-sup world. And it's one of the questions, you access the subsidized version of CSG that we offer to our contracted agents at no cost through our own premier SMI.website, because we got to remember we're not looking to put all our eggs in one basket, and we want to make certain that you have access to as much information as possible. Some of the other things we're going to do for you, if you're looking to contract with multiple organizations, so Reggie, kind of an adjunct to your question, some of the things that we use a quoting tool for is not only determining price, structure, or history of that program, that med-sup program, but also we want to make certain that you are aware of the carriers that are in your area that are most competitive price-wise, and give you some information through the expanded view as to how long they've been in the market, the premium they have. So a great way to make certain that you have a variety of programs that are specially guided for your area. And in many circumstances, completing this program through SuranceBay allows you to set up an agent profile so you can complete that process electronically with the majority of the carriers. Some of the carriers don't recognize this system. Most of them have an electronic contracting piece that you can access as well. But this is a great way to give you access to multiple carriers without having to go through an 80-page contract for each of them. We do also offer discounted errors and admission coverage to qualified agents. This is a program you purchase. You're not being added to a blanket E&O policy for just one or two programs. This covers you regardless of whom you contract through. Most independent agents don't put all of their business with a single marketing organization for a number of reasons. Well, no one has every program in the world, nor should they probably want to, but this gives you the assurance that you're covered regardless of whom you're contracting through, and it even includes variable products. So you in the universal life or annuity world that deal with some of the variable pieces of that can be very helpful. We also offer discounted continuing education through our relationship with WebCE to make certain that your license stay in play, and you can add to your own benefit package through a modified guarantee issued DI policy that you're paid commission on to add to your own benefit package. Much as where today's presentation is being recorded, past presentations have been as well. They're available on the Premier website, premiersmi.com, or through our YouTube channel. These speak to not only tools like we're discussing today, but also specifics from different carriers with different products and also different marketing techniques to get in front of folks to actually offer the programs that you're contracted with. We also want to make certain that you realize that many of these carriers also have other incentives and trips that you can qualify for, so we've bundled them in a manner of speaking into our website so you can find them all in a single area. That might influence contracting in certain circumstances, but we want to make certain that you're paid everything that you can be paid, and many of those incentives, including Medicare supplement business, can help you qualify for the Premier convention as well. Some of the other things we do to put you in front of people, we do have a custom contact list available for you at low or no cost, depending upon your contracting situation with our organization. And we do have programs to help put you in those centers of influence in your community. Retail marketing, the Walmart program, or the other market venue programs offered by the carriers. We speak to not only the availability of that program, but also how you can best access all the benefit out of it. So maximizing that value. We had a webinar on that actually last week. Also, how you can approach other centers of influence in the community, like faith-based organizations, provider marketing pieces. We have programs set up to help you be successful in that area. And keep in mind, depending upon the situation, we may be doing these live or we may be doing these virtually. And you have the opportunity to use these sales tracks and information to help you do that successfully either way. When we hit AEP, many of the MA and PDP carriers will also offer leads to agents that have done business with them in the past. I used to refer to them when I worked for United Healthcare as Lazarus leads, because they generally went through a captive first and then, okay, there's kind of an aged lead for you. But there are circumstances where they press out fresh stuff, and that's more of a quid pro quo type of situation. But those are controlled by local market leaders, by those carriers in your market. So it's great to have that relationship with those folks to put your first in mind for those individuals and those leads. We do also have internet lead and direct mail support programs. Direct mail is a subsidized program based on production, really cuts the price of those programs. It really also helps you do it consistently, because direct mail is much like an exercise program. If you do it just once or twice, you'll get a little bit out of it, but you'll feel the pain. You do it regularly, you're going to have success and grow from it. We have two different programs in play, one for Medicare ancillary and one for final expense. These are the preferred lead vendors that we use. We do so in order to help assure that the programs are compliant. And that's the reason we do that. And it's one of those situations, if you're looking at AEP, you better get on it lickety-split, because the longer you wait, the lower your return can be in these situations if you control the campaign. But we do also have a couple of other programs that are mail leads, but they are the returns. The challenge I see with that personally is you don't know if they're as fresh as if you directed a mail campaign on your own, but that's one of the things you can do to help with your budget as well. These are Facebook leads that are shown here, where MedSup leads are available at a discounted rate, final expense a little bit higher, but these are fresh off the press. You got a fast turnaround with these, and so they're very helpful. And then, of course, don't forget all this electronic access. We're going to provide you as a contracted agent with us through the different systems that come into play. I'm going to send you a link to that full Medicare Center presentation. It was actually completed this morning. What we're looking to do with all these programs is earn your business. We want that business. We're asking for it now. We'd like you to do as much business with us as possible. We also want to support you as much as possible. So what people see a lot of times are the commissions and the rewards and the trips and that sort of thing. We got to keep in mind, in order to access this part, we have to do some of the homework on the back end. This system is something that I feel every agent active in the Medicare community needs to use as part of their overall marketing and sales program. Your determination to use this tool, available without cost as a contracted agent, gives you the opportunity to maximize your most valuable resource, and that's your time. It also gives you a way to get business issued more quickly, because back in the old days when I worked for a SNP program with United Healthcare, 70% of our applications were pended at one point in time because the folks that were processing them couldn't read our handwriting. You do things electronically, it slides through much more quickly. As we become comfortable with it, we're able to make it much easier for folks on the other end. Anna demonstrated how easy it is for someone to sign an application through their system electronically. And I think as we go through this, as long as we are maintaining relationships with our clients, it's just going to make things much easier for all of us. So it's something that we need to have you come into play with and make certain that you utilize. You can reach any of us for additional information through our toll-free number at 1-800-365-8208. There is also our website that you can access. I'm going to check questions one more time. Pardon me. Make certain that I'm not being repetitious. Reggie's left. He had a question here as to an active producer number through a brokerage firm other than Premier. It will work on the MedSup piece. It won't work on the Medicare Advantage piece. You'll be able to see all the carriers, but if the contract's not with us, it'll push you out to utilize the, you still use the comparison tool, but the enrollment process on the MA piece would be through the MA carrier itself. When a client has Medicare and Medicaid, will this platform show their levels and what plans could best fit their needs? That was the piece that the slide that I had in there about the low-income subsidy for that piece of it. The Medicare and Medicaid doesn't affect the MedSups in such a manner. The other programs will help you with that. So that's basically the questions there. And we've gone 4 minutes past. I apologize. I want to thank Anna for her help today. We appreciate the investment of your time as well, and realize that that is your most precious commodity. Watch for the follow-up that will be coming, and we will make certain that as soon as the recording updates, we get that out to you, and we will reach out to you for further questions as well. All that said and done, until we have those discussions, hey, we wish you good selling. Thanks so much, and we'll talk to you very soon. And thanks again, Anna.
Thank you.